Welcome to the Ocean County Library's 2021 Autism Educational Fair. I'm Lawrence Jones.
And I'm Joni Jones.
And today we're going to be speaking about autism, mental health, and cultural competency, very important issues in today's world. So Joni, for starters, as a mental health nurse, why do you feel it's important for parents and family members of persons with autism to keep focused on issues of mental health?
Well, first of all, let's look at the general statistics. 1 out of 4 Americans are diagnosed with mental illness. That's not including those that are not diagnosed, and it certainly were the statistics before COVID-19. So those statistics can be even higher. When we look at individuals with autism spectrum disorder, we're looking at individuals that have anxiety, stress, fear, things of that nature, because this is a neurological disorder that impacts socialization, communication, and behaviors. If we look at the top 2 diagnoses in mental health, it would be anxiety disorders and it would be depression.
So what does underdiagnosis and dual diagnosis mean? And how is it relevant to a plan of care for a person with autism spectrum disorder?
Well, what happens in autism spectrum disorders is sometimes you get an underdiagnosis, such as attention deficit disorder or oppositional defiance disorder. And the symptoms of autism spectrum disorder come as an individual gets older because there's more social demands that are placed upon them. So sometimes there's more to a diagnosis. In other areas, what I see is there's what they call a dual diagnosis, where they might say, okay, somebody has agoraphobia, which is related to a social disorder, and that's one example. And with that, is it really coexisting? If they say that somebody has anger management or depression or bipolar disorder, it's a matter of looking, is there 2 diagnoses that are existing, or is it falling under one umbrella? And that's why they change the diagnoses to fit in the category of mental health, so that there can be better screening of the issues that are involved.
So in your experience as a nurse practitioner, do you find that when there is a case of dual diagnosis, for example, that the patient is older as an adult, or can this be diagnosed even as a teenager or even as a young child when on the spectrum?
Well, there's different diagnoses that emerge at different ages, and you may see somebody that does have a diagnosis of manic depression, even psychosis. So it's not uncommon for people who have the manic depressive disorders that there can be an accompanying psychosis where they may be hearing voices. We might see somebody that is paranoid. So in their thoughts, in those perseverative thoughts, they may misinterpret socialization and communication, and that's where the paranoia comes in place. So we really have to look at a spectrum of symptoms and traits and intensity to each individual, on that individual basis.
So do you find sometimes that the immediate family of a person with autism spectrum disorder, parents, siblings, well-meaning loved ones, sometimes they are unaware of the situation until long after the issue could have been diagnosed?
I see this quite frequently. And in fact, some people might come in and say, oh, I heard that term before, and people said that before, but I really didn't know that, or I didn't understand that. And some people that have traits themselves, when they look at the traits in their children, even if they're growing up, they just think that that's the norm, and they don't see where it actually fits in a different category.
So do you see cases sometimes, obviously every case is different, but are there occasions when the loved ones may be actually resistant to a diagnosis or dual diagnosis?
Well, there's still a stigma that is associated not only with autism spectrum disorders, but also with mental illness. So it is very common for somebody to either minimize a diagnosis or just deny it altogether, not really understanding the importance. So the importance of the diagnosis is really to have access to care, whether that's going to be covered by insurances or to develop a plan of care. So it's very frequent that we see somebody that, based on the stigma and what their frame of reference is and what their predicted outcomes are, if somebody does have that diagnosis, that they will minimize or deny it altogether.
So when you say there's a stigma, you mean people perhaps unreasonably or unknowingly feeling that there is something to be avoided by a label, which could, if the label was appropriately utilized, could enable someone to access services that would not otherwise be the case.
Yeah, and I think what happens is although we have come a long way through the years, there's still, if somebody doesn't feel that with a certain diagnosis that the outcome is going to be positive, or it's going to take a lot of work, and they're getting part of a diagnosis, like a underdiagnosis, like let's say the sensory processing or attention deficit, they might want to just deal with those issues instead of the overall. And then as the individual ages, gets more demands placed upon them, and they digress even further, then it's like, what happened?
So I've had occasion to see many cases where a child, for example, a young child, manifested the signs and symptoms of autism spectrum disorder, or at the very least was in a high risk category because of the symptoms and behaviors. And yet parents, because perhaps they felt that there was a stigma or would be a stigma, resisted not only the diagnosis, but resisted even testing for a diagnosis because they did not want the quote label, as you say. And as a result, they could not access services to the same level that a child with the diagnosis would have been able to. So at an older level, do you see this happen sometimes with older children, teenagers?
Well, I actually see it quite frequently, especially when I have individuals that are living in group home settings, and they'll start out with a mental health diagnosis. And then as I get to know them, I will see that there are more symptoms of the autism than there is the mental health diagnosis. And, with mental health diagnosis, many times they're prescribed medications, and those medications may help a person sit, attend, focus. It may help any type of psychosis if there's voices, things of that nature. But when we're talking about the skill development of somebody with autism to get them to their potentials, even to live in the least restrictive environment, or even to seek volunteering or employment, it's very important that we address those issues. When we're looking at social components, for example, we may have somebody that is malodorous because they're not showering because the water is very uncomfortable for them. So they avoid going into the shower. We may have some people that don't know how to interrupt somebody, and they're not aware of spatial awareness, so they don't know their boundaries. We have other people that don't know how to transition. So if you don't prepare them and give them some warning, they can go and blast out in anger issues. And these are more of the symptoms that are more consistent with autism. So when we start addressing the issues that we have identified, it's amazing the progress that they have made, which they didn't make prior to those interventions with just looking at the mental health diagnosis alone.
So in the last month, as we know, they've started changing the name of Autism Awareness Month, which this has always been April, to Autism Acceptance Month. So does that relate to reducing and hopefully eliminating stigmas attached with autism, as well as other developmental disabilities?
Well, I think the terminology is really open to an individual's interpretation, because if somebody is saying autism awareness, that might be okay. Let's be aware of what is happening, and that's when you get into the cultural competencies. And when you're aware of it, then it's like, okay, what are you doing about that awareness? Other people can interpret acceptance as, okay, the child has autism or the individual has autism, this is the way that it's going to be. So people have different degrees of interpretations of what the language is going to be. So it's going to be very interesting to see when that comes to be the universal language, how the public is going to respond to that.
So in view of the fact that it's Autism Awareness / Acceptance Month, what do you see in your field and in your experience, which can be done to improve and increase not only awareness but acceptance of autism? So there are no, quote, stigmas, and there are no fears and concerns which can impede a child or an adult's diagnosis and the accessing of appropriate treatment and intervention.
It's absolutely the, part of the awareness and the education of what are the presenting symptoms and what are the modalities that can be used to improve these symptoms. And once people become educated or competent in this area, and they have a better understanding of what autism spectrum disorders actually are, and that when you start to see the improvement, I think it's through that awareness and through that education that we are going to start to change the way people are thinking. Because we have to remember, years ago, individuals that may have been even severe in their presentation, there were not any interventions for them, and they were put into mental institutions. And even today, we're seeing some of those products of those situations. So we have like adults that may have been on the spectrum, but from a very young age, they've been sitting in and out of institutions, psychiatric hospitals for years at a time with all different types of medications, and they never were given those interventions. Because remember, it's just been, in about the last 20 years that the interventions have really blossomed and become, universal, where we are seeing people reach their potentials, and many of them are even going to colleges.
Okay. So against that backdrop, in your personal experience in the field, what do you see as being some of the major mental health challenges that a person with ASD may face?
Well, the person themselves, they may feel very isolated. They feel like they don't fit in, and this affects their confidence level. And some individuals themselves feel like, what's the use? This is the way it is. I'm not going to be able to work. I'm not going to be able to volunteer. I'm never going to be able to live on my own. So there's a lot of that self-talk that goes on inside that really prevents an individual from the skill building access. But like I said, once we start getting challenges that are identified with individuals, and we start the skill building process, and there starts to be some type of an improvement, some individuals who are capable of driving may not even feel like they're capable of driving. Or if some of them are really socially phobic, then they're not going to use public transportation. So it really stifles and isolates, and that can cause a lot of depression in individuals because they're not really experiencing the full effect of joy. And some of them feel that they're not going to be able to develop relationships or get married or raise a family. And these are all things that for many individuals can happen. But if they don't think that they can happen, they won't feel like they'll happen, and their response will be that they won't happen.
So the depression may not be because of the autism, but because of some of society's reaction to autism in certain cases, which creates some isolation.
Sure, and it affects, the confidence level, and some, like for example, we have with autism spectrum disorder, many times individuals can't identify their feelings. They may be able to tell you what happy is or what sad is, but when they're having a mixed emotions, whether it's frustration, whether it's disappointment, whether it's sadness, all those things, even boredom, they may come out as anger because that's a very easy display of emotion. So if they're not identifying what their feelings are, then it's very difficult for them to problem solve how to respond socially in an acceptable manner. And then they become, a prisoner in their own in space many times.
So you agree autism is in large part a social disorder?
It's absolutely impacts socialization, it impacts communication, and it impacts behaviors. And the interesting thing about it is that it's a spectrum disorder, so it's going to affect everybody differently. So somebody might have more traits than somebody else, and somebody else might have more intensity of some traits and maybe not others. So we really have to look at each person as an individual and look at what those traits are and how it is impacting, their overall sense of well-being, how they are caring for themselves, how it's impacting their socialization, their opportunities for employment. So all those areas we're going to look at to see what exactly is the skill building that they need to set up to be successful in those areas.
So you see a lot of times with children with autism, as they grow up, they have they're in a special education program, they have an IEP, an individualized education plan, and the overwhelming focus of the plan tends to be on academics, tends to be on improving in math or English or whatever the course may be. And really not as much energy or specific active plans relative to increasing socialization, right? And so when that happens, what are the risks to the child as the child grows older when everything or the overwhelming majority of the focus of the school's focus, as well as sometimes parental focus, is put on academic success as opposed to social success?
Yeah, I think that we're making some movement in that area, but when we look at what the school districts are doing, they have their core curriculums that, they have to base their IEPs on. However, what happens is that when these behaviors start impacting learning, so for example, when we're looking at the neuroplasticity of the brain, and that's the ability to change through learning. And there's certain prerequisite skills to learning. So for instance, if you can't even get an individual or child to sit and attend or to sequence and all those prerequisites to learning, learning is going to become more difficult. So they're kind of forced to address some of those issues. And this is why education and caregivers' involvement become very important. Because if you have an individual that is not speaking, that is going to be one area. If you have another individual that can speak, but it's not functional language, or the people that we see through the cracks where, and this is very frequent with your higher functioning autism or the level 1, previously known as Asperger's syndrome, you can have some very misleading presentations. For example, you might have a child that learned to read when they were 2 years old. You may have somebody that can tell you the square roots of everything, but can't tell you how they got there. And then some people think, wow, they're just such a genius. They don't need any extra services. But what happens is very often we see these individuals fall through the cracks because as those social demands become more and more demanding on them, that rote memorization, or those who have more of a photographic memory and they're responding to that has been very misleading. They can't function in the real world because they are lacking those social skills that are very important if you're going to develop relationships and gain meaningful employment.
Okay, so that being the case, what can be done to improve social skills, and not just at a child's level, but for example, an adult who maybe did not have IEPs that focused significantly on social skills along with academic skills, and did not have the recognition and necessarily the support and support structure that others were fortunate enough to have. What can be done to improve the social skills?
Well, first of all, I think there has to be an identification of what is lacking. For example, if somebody can't maintain eye contact, or if they can't sit still and they're doing the self-stimming behaviors and things of that nature, even as an adult, once you have that awareness that there are some of these social deficits, I usually recommend to have an evaluation done to see what else is missing in the foundation. And once you develop a plan on how you're going to work on these individual levels, I think role playing is very, very important. So again, if you have somebody that doesn't know how to respond to unexpected situations, and you see that anxiety surge and that anger comes out only because something caught them off guard. If they're aware of these things, and then we say, okay, what we're going to do is we're going to start giving you a little bit warning that in 20 minutes this is what we're going to do, and then you start as you're practicing, go down in the time, and the time further through that practice, it becomes learned behavior. And then you start to see that that skill is developed, and then it's no longer an issue. So all those things become very important. Just like if you're, if you're with boundary issues and you're sitting there and you're knocking up against a person and you're not giving the space, that can provoke fights in a social situation, especially if you're doing it to a stranger. They won't know what you're doing. So when you can identify these and use them, through the role playing and the social stories of prediction. So for instance, what do you think would happen, or might happen if this is what's done? And you start, utilizing those strategies to help with the skill building in those areas of socialization.
So if you have someone, they grow up, they're on the spectrum, they have not had a great deal of intervention relative to a focus on social skills and development, maybe academic, but really not enough socially. So they may graduate with honors. They could do wonderfully and get A's in technical classes. Now it comes time to go for a job. You mentioned before the depression and issues about, if someone with a disorder feels isolated, or that there's no ability to move forward, the negative impact that can have. So what are the potential consequences to a person on the spectrum who has had insufficient social training by the time they go for a job interview?
Yeah, well, this can be multifaceted. So for example, if you don't divulge that you have a spectrum disorder, that can be completely misread by the person who's doing the interviewing if they lack the competency. And sometimes even when you disclose it, they may not be completely aware of what the presentation might be. So for example, there are so many things that can be misinterpreted. Some of the examples, like I said before, if they're not maintaining eye contact, somebody can look at that as they're being evasive, or they're not telling the truth. Or if they're sitting there because they're trying to integrate, sensory with the anxiety, and maybe they're sitting there tapping their pen, or shaking their leg, to try to get some of that input that becomes calming for them, that can easily be misinterpreted. Also, if they have literal translation, they may misinterpret what is being said. Or if you have an interviewer that is throwing some sense of humor in there, they may not understand that sense of humor and be completely misunderstood in the aspect of even having, a sense of humor in the first place. Also, perseverations of thought. So you may be talking to somebody and they may have wanted to say something else in the interviewing process and they didn't get it out. So they're not really quite listening to what you're saying because they're still stuck back on, oh, I should have said this and, I want to say that. So there's so many things. However, just like you would do in any situation, I think today there's a lot of self-help videos that, help an individual learn about how to interview and what to look for. And the role playing to me is extremely important, and the positive reinforcement. So if there's any type of family member or professional or anybody, job coaches, anybody that can prepare them in transitioning to employment, those are some very important points that should be addressed and prepared for going into that process.
Can this be done before the person is of interviewing age as part of the long-term training?
Absolutely. The earlier that we can get the skill building process underway, because it affects so many different areas of life, so there may be some people that they don't know how to make their needs known or how to compromise. And then in the social setting, they may just be sitting there watching, other people. And then in this day and age, unfortunately, there's still some bullying that may be going on. And if somebody is vulnerable like that, and there's some bullies, this can really affect an individual where there's later on, we're seeing some post-traumatic stress, some sleep disturbances, some hesitancy, some thoughts like, no, I did that and it just didn't work out, or no, I don't want to do that. And they just come to a false sense of acceptance, and it really stifles them from reaching their potentials.
So you mentioned two terms I want to focus on. One is post-traumatic stress disorder. First of all, in general, what is that? Not everybody knows exactly what it is. And number two, how can it relate to a person with autism spectrum disorder and the struggles they may be facing becoming an adult in the world?
Okay, so I want to take away the term disorder, because when you get into the diagnoses, there's so many different tributaries that make up diagnoses for the post-traumatic stress disorder. However, when we're talking about trauma and post-trauma, that can happen at any given time, and it could be any type of an experience that is causing flashbacks, where you're reliving that situation, you're having perseverative thoughts of that. There might be triggers that can be from any of your senses, whether it's taste, smell, visual, any of those things that remind you of something that was an unpleasant experience for you, or that you saw somebody else go through. And then what happens is it just triggers this adrenal gland response that there's some type of threat or danger. Now, what becomes very important about that, and I just want to talk about the adrenal glands for a moment, because when there is this underlying anxiety or this fear, and there's some type of threat of whether it's imagined or if it's real, there's those survival mechanisms that go off. People may have heard of it as the fight or flight response. And we see that if there's a fire, it's like, there's a threat, there's a danger, and we have that fight or flight. Well, what happens is when somebody really goes up in those hormone surges, it's an autonomic nervous system, which can affect your blood pressure, your pulse, your shaking, feeling nauseous, all of those things that make somebody feel uncomfortable before they go into, some people actually go into a complete panic attack. But the important thing to note is that this will set them inside of the brain that becomes very impulsive. It becomes very reactionary. And an individual will then respond to what they believe is happening. That's when we get into the what ifs and not the facts. The problem is when you're in that side of the brain that you don't have any logic. And if you don't have that logical processing going on, it's very difficult to problem solve. And this can go on for 90 minutes. It can go on for 2 hours because that's how long these hormone surges can last. What we want to do is we want to get them into the side of the brain where they're not so impulsive, they're not so reactionary, so that they do have time to look at the facts, what's happening here and now. And when they're able to do that, then they can start pulling on some of that logical thinking, and that's where the problem solving takes place.
Okay. So the other term you referenced is cultural competency. Cultural competency. I know you presented on this in several different forms. So what is cultural competency as it relates to autism spectrum disorder?
Well, autism spectrum disorder is a culture within itself. So you have people that have a lot of similarities, even though it's not exactly the same. Experiences will contribute to some of the differences in the cultural aspect. And many people who don't understand or they're not educated on it, like I'd said before, that not only are they not competent or aware of what's happening, they're not sensitive to the person's needs. And this can lead to a lot of those misunderstandings. So what we're trying to do, especially, what we've been doing in this autism awareness/acceptance month, is this is a time that we're trying to get the education out there so that there is a better understanding of individuals that are affected by autism spectrum disorder, to have a greater understanding of it and not to misinterpret or make assumptions or have their own biases to what the disorder is that's going to impact the individual. And what we really want to move towards are the inclusion and learning from them, because each individual has their great contributions that they can make to society. But in many cases they just need the opportunity and the chance and the the avenue to be set up for success to be able to make those achievements.
So when you think about different ways that cultural competency or a lack of cultural competency or a lack of cultural sensitivity can negatively impact the person on the spectrum, think of different settings. You got the legal system, you have the employment, employee-employee relationship, social settings. What are some examples of how things can work against a person on the spectrum, and conversely, how things can reinforce and constructively build up the person with autism spectrum disorder?
Well, we see so many times that there's statistically, there shows that people with autism spectrum disorders have difficulty in many cases maintaining jobs. They go from job to job to job because they don't quite understand the expectations. So for example, if they're really caught up with logical thinking, and there's politics of employment that are involved, they may get stuck on what is the logical thing to do, not the cost-effective thing to do, but the logical thing to do. And they may become very perseverative and they can't get off of that. And that may be very challenging to coworkers or to bosses because they don't understand, why they are thinking that way or why they are responding that way. When we look at a situation in a legal system, let's say, it's open to a lot of interpretation just from merely not being able to maintain eye contact. There's a stigma and a bias that are associated with that. They might think the person is lying or being evasive when it's just really uncomfortable for them, or it's hard for them to look at facial cues and look at that without it increasing their anxiety. So they can't really think and look at the same time. And if somebody is very restless and bouncing around, or they have that delayed processing that they need some, you know, a little bit more time to process, or even getting back to the employment for a minute, if somebody has like a great deal of detail and their, you know, their attention to detail is so great that they're picking out like little minute things, or, you know, if there's some obsessive compulsion, you know, that's behind all of that, totally can be misread. And if somebody else takes that, you know, more personally, or they feel that it's a more challenging for them to deal with it, they may just tell the individual that maybe this is not the right fit for them, instead of learning how to work with them, skill build, and problem solve them through it.
How about special challenges in some instances? Obviously, every person is different, every person is unique, but some of the common situations you see challenges for adults on the spectrum socially.
Well, again, there's such a array, and with adults, sometimes I see that their intellectual level is so high, and they use words that are very sophisticated, and there may be people that, you know, don't understand that, and they get very offended, and they might say, well, you think that you know everything, and they turn it around to something that is very negative. So we can take so many different presentations where somebody might just become more introverted because socially they don't know how to be resilient. And this is where we get into resilience training, where they're not taking it so personally to what everybody else is saying. And, you know, socially, I run into a lot of people that are still that people pleasing. They want to gain acceptance, that they don't know how to say no. And that becomes many often times where individuals be taken advantage of. And so there's so many different ways when you look at a person's presentation and how it's impacting them. But so many times I see that low self-confidence, that isolation, that I don't think that, you know, I'll be able to do that because I tried and I failed at that before. And if somebody thinks that they can't do something, they're going to feel like they can't do it, and their response will more likely be that they're not going to do it.
Do you find sometimes it's I guess paradoxical or ironic that children with autism are often described as wanting to be isolative or not communicating with same age peers, and they're more interested in objects than friends, that type of thing. But then later in life, while still on the spectrum, there's a great desire to have friends. There's a great desire to be social, and just some challenges in actually making that happen. Do you find that that's the case sometimes?
Yeah, I find that many times they just don't know how to do that. They haven't learned how to compromise. So socialization, even as a child, can be very misleading. Somebody might say, oh, my child is very social, but what they're doing is they may be engaging in activities where they are taking charge. And then when it comes time for them to be able to compromise, they may say, nope, I don't want to do that, because it's very hard for them to compromise, because they may not have been taught empathy, or you know, that social reinforcer is not there. And that's why many times we have to look at different things that are reinforcing or motivating for them to learn certain skills. But many times they just don't even know even how to interrupt or make their needs known. So if somebody's in a conversation, I see adults that will just come up and they will just interrupt somebody, and then somebody will get annoyed, or they're so busy thinking about what they're going to say that they haven't learned to be effective listeners, so that they just jump in and they interrupt, you know, the conversation that may even be advising them, and they may be negating it before they hear the whole story. So that's why, in each person's presentation, I think it's always beneficial to have, when you acknowledge this as a challenge, to get the additional supports, to get the additional evaluations that in the field that people are well versed in. So sometimes we get them in programs that will take them back so that they can succeed in the skills that are necessary even to volunteer, so that they can start having some relationships, they can start having some joy, they can start feeling like they're productive. Because remember, when we're looking at adults today, a lot of these adults were put in mental institutions, or they were, in their homes, and now their parents have aged out and can't care for them. They're thrown in a whole nother different, environment, and they haven't been prepared for this. So depending on, what level they're at, what experiences they have, what their presentations is, that's what we have to do on an individual level to take back and build those foundational skills that are going to help them reach their potential, whatever that might be.
So when you say building supports and foundations, obviously you can get supports with educational training in school and different programs, but how significant is family support?
Well, it really depends on the relationship with the family and how educated the family is. So I see twofold. I see parents that when it's time to let their adult children go and have their increased freedom, they're still being overprotective of them, and they're relating to their own happiness and what brings them joy, and not looking at their adult child of what makes them happy and what brings them joy. So in those particular areas, that can be stifling, especially when it comes to letting go and building relationships and letting their child, fall and brush themselves off and pick themselves up so that they can grow and they can learn. Because in the chronological, events of life, many times, the children are now going to outlive the parents. And if the parents don't start preparing for that, then we see, a whole nother, problem surge. But if you have the support of the family, that is when you can many times educate and utilize the family, especially when they're going out on different, environments and things of that nature, to transfer these skills into the natural environment, and then be more receptive to things like, for instance, some people might start out with a job coach and they're learning these skills, or they might go to an afternoon program where they are learning, the skills to prepare them for that in the real world. So depending on the relationship of the family, and their education, it could be a very positive and rewarding thing, or sometimes it can be very stifling.
So when you talk about preparing people for the future, some people have different views on volunteering. Can volunteering be a potential component of a long-term plan for a person on the spectrum's future?
Absolutely, because again, we really have to look at the overall situation, and the way that it's set up. There's a lot of individuals, depending on where they are, what their functioning levels are. But you have some people that are making a certain amount of an income, and they either are very limited in what other income that they can make on top of that, which becomes a big factor in individuals' decisions on whether they are going to, work full-time, part-time. You have other people that have such a social phobia, and they're afraid of, are they going to make a mistake? Are they going to do something wrong? And they really need that transitional period of doing some really light, volunteer work. And sometimes that starts out in a program itself. So you see individuals that may be cleaning in the area of where lunches are served, or keeping the grounds outside, and just learning some of those basic skills. And then you take those skills and then you transition them into a non-threatening community setting. And, you know, whether they need extra coaching or they start doing that on their own, it's all individual, but it's all a progression. But I see many people that didn't do anything. And that's what I mean. They had no diversity in their life. They were just sitting in the four walls and maybe looking at a computer, or, you know, being more in their heads, or they're spending years in therapy and going to groups where they're not really advancing socially, where they can have that building of friendship, that maybe they go to the movies, maybe they go out skating, maybe they have a dating relationship, maybe they go to barbecues at amusement park, all of those things, you know, that are achievable in the bigger spectrum once you start, you know, getting those foundational skills solid.
All right, so let's assume you have a situation where, you know, a young child or preteen or teen with ASD is receiving supports, solid, strong, consistent supports, academically, socially, family support, and is doing very well. Okay, to the point where he or she is graduating high school, now looking at life beyond the age of 18. What are the possibilities of things like college, grad school, things of that nature? And how has the situation and opportunities in that area expanded over the past 2 decades?
Well, I think the earlier that you can start, you know, preparing for that, the better, because there is a very big difference between somebody being in a very structured, comfortable environment, now all of a sudden being, you know, thrown out to a college situation. So when preparing for college, you know, it may be that the individual doesn't start living on campus year one. That may be a goal for year two, if that hasn't already been, you know, practiced or anticipated. So it also depends on the skill level and the emotional response level of the individual. And many times, you know, there's throwing somebody in the workplace on top of trying to transition to a college that may be just a little bit too much too soon in that transitional process. You may have some people that, you know, are holding back in what the college campus experience has to offer, such as the different clubs and committees, which can be very frightening to somebody if they're there by themselves and they don't know how to pick up on the social cues, and they don't know how to you know, to integrate. But what I have seen when I worked on an inpatient unit in a hospital setting, it was very surprising how many college students in themselves, you know, have experienced depression in a college setting. And, you know, some of them, to fit in, they have engaged in some risky business. Maybe they began drinking or dabbling a little bit into the drugs. And, you know, it's very uncharted waters today and what those responses are. And then there's some that they just don't know what to do. They get all mixed up, that they don't even know if they want to continue to live or not. And this is when they wind up as college students in a hospital setting because of being overwhelmed. So it's something that every person should not take lightly, because the demands of going into that setting where there's a multitude of experiences that are going on, it's hard to predict without still staying on top of everything and having that open communication and, you know, identifying what challenges there might be. And this is where I actually wrote an article on this because I had multiple people come in where they weren't even diagnosed with autism spectrum disorder until they got into that college setting. And that's when, the peer groups of same age with people who are on the spectrum and reading the literature that were written by same age peers become very valuable, because once they start to feel that they fit in, or they're not walking alone, or they just don't they just don't feel so hopeless anymore. They feel like they have some type of direction, and then it's like, oh, it gives them a whole nother light and openness to start to skill build and to manage those feelings and experiences as they are preparing for adulthood.
So when you talk about the college experience, you're talking not so much about the academic challenges, but the social challenges, such as living on campus, various social clubs, perhaps dating, things of that nature.
Yeah, because many times people are familiar with Rain Man, and somebody that can be very, very savant or academic or whatever, but if they don't learn how to navigate socially, that can be just as detrimental. So it becomes non-functional. So whatever area becomes non-functional. So many times, there's people that have, for instance, they have the academic abilities, but if they don't know how to communicate, let's say are individuals that might be nonverbal, they can or sensory, where their, sound is very painful and they're responding that way. There's so much of a misinterpretation, but if we do not, mold the cognitive ability, which usually is not effective unless there's, coexisting things that are going on, along with the behaviors and the behavioral responses. If we don't get them in sync, then we're really not preparing for them to be reaching their potentials in society.
So essentially then, if there's a lack of preparation, you're increasing the chances of significant challenges in the transitional years of, for example, college, which could lead to depression, post-traumatic stress, and other mental health challenges because of the situation, not because of the autism, but because of the situation.
Right, serious consequences. And that's why it's important, so many times, I have heard, parents that if they're not immediately dealing with the situation, they'll say, oh, well, we'll deal with that when we come to that. And when you're dealing with people with autism spectrum disorders, they really need to prepare for that, because, we want to, in order for them to develop the skills, they need to master those skills across all different environments. And when they're learning, higher skills, it's not unusual to lose those other skills. So we need to not only skill build them in different areas to get them to master them, then we need to get them into the opportunities where they can transition into a natural environment. And then, role play. And this is where speech therapy many times comes into place, and the social skills, like what would you do in this situation? So you take real life situations and ask them, what would they do? And that's how you prepare them so that they will know how to respond. Like I said, there's some people that don't even know how to say no, and that will get somebody in a lot of unwanted situations throughout their life. And it's a skill that somebody does have to learn how to do.
Okay, I see we only have about 3 minutes left. Very quickly, the use of physical health and exercise to support mental health, from a nurse's standpoint, the connection.
Yeah, well, I always say, if you don't have physical health, you don't have mental health. And if you don't have mental health, you don't have physical health. And what I do see in a lot of individuals that are on the spectrum, I see a lot of obesity. And the reason for that is a lot of them are engaging in eating and more of the comfort foods, and they may not know the skill building on how to cook, how to have kitchen safety, all of those things. And when you have somebody that has obesity, then you have all the obesity related disorders: sleep apnea, the silent killer, high blood pressure, high cholesterol, not even being able to physically have the endurance. So
possible depression as well.
well, in the depression, absolutely. And that's where, you know, if you're talking about stimulating all the endorphins in the brain, that's where the exercising comes in. So whether, you know, somebody can post-COVID, you know, advance to a gym setting, I see that a lot. I see a lot that take advantage, especially in New Jersey, going to the beaches and walking on the boards, because they're getting that input of the air and the wind and everything. So the exercising is very important. But I can tell you that as far as health-wise, a lot of it is related to obesity.
Okay. So everything connects up is really the bottom
Yeah,
line.
I always say, you know, you can have the best of health, and if you don't have mental health, it's just as debilitating. And, you know, it's vice versa. So you can have great mental health and not physical health, and that's going to be just as detrimental too. So we really have to find the connection, but it's all going to go back to the skill building. And with the skill building, it is breaking down the components, utilizing an individual's strength to address their weaknesses, and then practice, practice, practice until the skill is mastered.
Okay. All right. Well, we're out of time at this point. We want to thank the Ocean County Library for inviting us to participate in its annual Autism Education Information Fair. We want to thank all those who attended for taking the time to listen to this program. I want to wish everyone the best of luck, whether you have someone in your family with autism spectrum disorder, or a friend with autism spectrum disorder, or simply you want to become more aware, more culturally competent, and more culturally sensitive to issues surrounding a person with autism spectrum disorder. We welcome your participation and attendance, and hopefully you found this program to be somewhat educational, something to think about. Joni, any final comments?
I totally agree. And if there's even, you know, one thing that you walk away with from watching this presentation, that one thing can be the missing link that really brings an individual, you know, up to the potential that they need to be at.
Best of luck to everyone, and happy Autism Awareness and Acceptance.
Have a good night.